Raise your hand and then say present.
No, say he just listen.
Commissioner Casteen, can you raise your hand? We can see him and did a test earlier and he can hear us, so. We have a quorum, but we need to make sure Commissioner Casteen can hear us and can vote.
I'm serious. He had write it down.
All right, it's the best.
I hear him mumbling.
Public comment will be available on each item on the agenda and during general.
The meeting. Each speaker will be allowed 3 minutes to speak. Public is attending this meeting in person in the Bourne Auditorium, which is here, and remotely via WebEx and on the phone. The public comment period. During each public comment period, we will first address any person comments, then WebEx attendees, then phone attendees. For any person public comment, please fill out a yellow public comment card available at the back of the room and bring it to me. Not required, but it does help me organize public comment. For WebEx attendees wishing to provide public comment, you will be instructed to use the raise your hand feature when I announce public comment. The meeting moderator will call on you when it is your turn. For phone attendees wishing to provide public comment, when your item of interest comes up, dial *3 to be added to the speaker line. Then wait for the prompt before speaking. The phone number for this meeting is 415-655-0001, and then the access code is 2661-761-6491. And then press pound. If you are asked for a meeting password, enter pound again. When connected to our meeting via WebEx or phone, you will hear the meeting discussions, but you will be muted and in listening mode until public comment is open and you raise your hand or enter *3. If remote public attendees run into any issues, you can text me at 415-535-2386. And I'll try to coordinate with my tech support here and figure out how to help you. That is all for public comment rules. Thank you, President Crum.
I agree with you, Bob. Yeah. Are there any comments or questions from the commission regarding the agenda? Hearing none, is there any public comment? Can I have a motion to approve? I need a help you then, so can I not? How do I go forward?
Just waiting.
Okay.
Commissioners,
Was you and I?
let's hear us. State your name. You don't hear me.
Hit video there. Says start video.
Yeah,
No.
yeah,
No. There.
yeah.
Yeah.
Commissioner, can you please go back on camera?
Oh, God. No. What are you doing? Just hit start.
Start it off.
No. Oh, Christ.
There you go. Perfect. Okay, we're about to vote on the agenda, so go ahead, Commissioner. We don't have any public comment, so go ahead and move forward with the motion.
Approve the agenda.
So move.
Yeah.
Second.
Oh,
All in favor? Aye.
Aye.
So moved. Thank you, everyone. Cool.
it's too loaded.
Item 4 is the adoption of our September 28th regular meeting minutes. Are there any comments or questions from members of the commission? Is there any public comment?
Sorry. We don't have anybody in the queue, so go ahead.
I move item 4, the minutes.
Is there a second? I saw his hand, okay. All in favor? Aye.
Aye.
So moved. Item 5 is the executive director's report, calling on Trent.
Try to move so I can see you. New configuration has me all unnerved. All right, good morning, commissioners. I'll start at the federal level, as I always do. As you know, Congress passed a continuing resolution that continued to fund the government through November 17th. In that continuing resolution was actually approval to continue federal funding for SNAP, which is a federal program over in CalFresh, through the end of the calendar year. So this was, I think Dan Kaplan reported this last month, SNAP or CalFresh is the only program that was sort of potentially at risk of not being funded should the government basically shut down on November 17th. There's no budget approved or another continuing resolution. So the fact that that was included in the CR is a bit of a relief for us because we're not going to have to worry about whether or not CalFresh benefits will be funded if government shuts down on November 18th. And so that'll be good to the end of December. The other programs would continue to be funded: Medicaid, Medi-Cal, Title 40 foster care payments would be good through the calendar year as well. And then TANF, which is the federal program that authorizes CalWorks. That was the authorization for TANF actually ended at the end of September, but the way the funding works, the state can actually front load the money for that and front load federal money later in the fiscal year, so that'll be fine. So basically, in short, should the government shut down on November 18th, our programs would remain whole, would remain funded, and clients would continue to receive benefits that they're entitled to receive. At the state level, we're sort of gearing up for the next legislative season. As always, the County Welfare Directors Association, CWDA, will sponsor several bills that we will have input on. Probably the most important one that they'll sponsor again is bill and budget funding to run supporting children and youth who have experienced complex trauma and have significant needs, placement needs, mental health service needs, and generally across multiple systems. So that will certainly be an item that they sponsor. And then again, we are going to, as a city and county, to sponsor a bill to allow undocumented residents of San Francisco to be in-home supportive services providers for undocumented family members. This is a bill we sponsored last year. It got held up, not necessarily due to opposition, but more due to some legal questions about how to allow undocs to get paid. That seems to have been resolved, and so Assemblyman Ting and Senator Scott Wiener co-sponsored last year. I anticipate them hopefully co-sponsoring again this year. So locally, I want to talk just a bit about, I'm not sure how much it was talked about last month, about a ballot initiative that the mayor submitted to be on the ballot for March. That is something that we crafted together with the mayor's office and directly impacts our programs. What the initiative will do, it doesn't have an initiative letter or a name, but it will be on the March ballot, and the mayor has the authority to put anything on the ballot that she wishes, just by a signature. So the initiative, which has already been drafted, if it passed, it would require recipients of county adult assistance, so in our CAPTAIN program, who have substance use disorders to engage in substance abuse treatment and would continue to receive benefits. which is, obviously a big shift in what we're doing for folks who are receiving CAP who have substance use disorders. But maybe we give you a little context. So the mayor has been very clear, I think, in the press and in other forums that she is extremely concerned about the record number of overdoses in San Francisco. She and her administration, Director of Health, myself, and others, of course. Just some statistics. According to the chief medical examiner, there have been 619 overdose deaths in San Francisco this year. In 2022, there were 647. So that 619 was through the end of September. So we're way outpacing last year. Close to 3 people dying a day from overdoses. In addition to that, there was about 25 or so EMS or SFPD overdose reversals a day. So 25 people are getting Narcan through the fire department, through the police, and they're saving their lives. So the number of almost 3 dying a day is a lot fewer than few folks were actually overdosing. We did a match with the medical examiner to see what the overlap or the incidence of overdose deaths and individuals who were getting public assistance through our agency. And what we found was that we took a 12-year calendar period from September 22 to August 23. About 22% of the people who died were either receiving CAP or had been receiving CAP previously during that year. So basically, almost a quarter of the people dying are getting cash assistance from us. It stands to reason that they're using the cash assistance that we give them to buy fentanyl and to die. Of those who died, 82% actually had fentanyl as the primary cause of death, and 89% had another opioid as the cause of death. So, seeing those numbers, presenting those numbers to the mayor, we both felt very strongly that we couldn't continue the status quo. We couldn't continue to provide public taxpayer dollars to people who were using it to kill themselves. So what we came up with was this proposal, which is actually allowed in state law. And there are several counties who already have this, Los Angeles being one of them, which says that if there's an individual receiving general assistance or CAP, and there's a reasonable suspicion, is actually the term in the state law says, if there's a reasonable suspicion that they have a substance use disorder, we can require them to be screened. That doesn't mean drug test, it means screened through an interview process. And then we can require treatment as a condition of getting cash assistance. And so that is the provision of state law that this initiative will invoke. Contrary to media reports and sensationalistic headlines that we're going to be drug testing on welfare recipients, that's just simply not true. There's no language around drug testing in the ordinance. In fact, drug testing as a condition of getting public benefits through CAP is illegal. It's against state law. The eligibility for CAP is based solely on income, assets, and residency, not on any sort of drug test, drug screening requirement. What this does is if someone is eligible based on income, assets, and residency, they get that cash assistance. Subsequent to receiving that cash, should they have a substance use disorder, this substance use treatment would be their required activity, very similar to activities that other recipients are required to engage in, such as workfare, applying for federal SSI, job training, and things like that. So it really adds an activity to the list of required activities that already exists in law. For me, it does a couple things. I think one, as I spoke to, it will hopefully decrease or end what's currently going on, which is people getting cash from us and then using it to buy deadly drugs. And the second is really, I think, provides us a really good opportunity to engage people who are addicted, who do have substance disorder, with a range of treatment options when they come to us. If they're coming to us for cash support, we see them periodically, whether it's to assess them for employability or offer them a range of services. They're in front of us and they're seeking help, at least it's for cash. I think that's an opportunity for us to engage them to see if we can help them get into treatment. And, we're not being Pollyannish, think that everyone's suddenly going to go into treatment and it's going to work. Obviously, it's a substance abuse phenomenon that I've never seen. I've been doing this work for almost 3 decades. It's cheap, it's readily accessible, it's deadly, and it's prevalent. So, and hard to kick. And so we know, eyes wide open that a lot of people are gonna say no, a lot of people are gonna fall in and out, and to give them plenty of opportunities to engage. They don't have to be clean to continue to receive county assistance, but they have to be engaged in a program of some sort. And we would verify that with communications with the provider. So it'll be on the March ballot. Operationally, we wrote in the ordinance, in the initiative, should it pass, it would become effective January 1 of 2025. So we have plenty of time to plan. We're already planning internally. It does give us a good runway because it's a pretty big shift. It will require contracting with substance abuse treatment providers, figuring out how to do front-end assessments by medical health professionals who really know the business of substance abuse, which really isn't our area of expertise in this agency. It's really falls to the Department of Public Health. We'll be partnering with public health to ensure we're going on sort of the right path. There's a poison pill in the initiative, which basically says if treatment is not available, you cannot take someone's cash away. So we have to set up the whole array of treatment and have that readily available for people. Or else we're not going to obviously take their cash. But it's very similar to the way the Care Not Cash works in terms of housing and shelter. So I support this. I helped write it. My staff helped write it. I will be active in my non-professional capacity in talking to folks on the campaign. Can't talk about it here, campaign wise, but in my personal time, I can sort of be active. I'm just letting you know that. See me out and about. That's kind of a big issue. I'll pause there if there are any questions specific to that. Otherwise, I can continue. Commissioner.
Interesting enough to share.
This morning, there was this San Jose officials talking about the program they're trying to put in place. As you talked about the wraparound services, as we call them, housing. How does that fit, and what is the role of homelessness in we're taking down housing, bringing it back or giving it back? Then where are we planning to go with that?
So, Commissioner, forgive me, I'm going to give you a little bit of sort of history on this issue as it pertains to housing in this population. When we brought on Care Not Cash in 2004, one of the problems we were trying to solve with that was substance abuse. We knew that back in 2002, we used to cut checks on the 1st and 15th, and clients who were homeless would go to check cashing outlets to get their cash. What we noticed then was that overdoses, emergency room visits, and EMS calls spiked on the 1st and the 15th. So same phenomenon, right? They're using cash to purchase drugs because they're addicted, they have a disease. We shifted to Care Not Cash to take the cash out of the system and say, let's put them in housing with wraparound services and get them housed first, and hopefully that will do with their addiction. We had a modicum of success. But fast forward to now, we've housed several thousand people in the city's permanent supportive housing style through Care Not Cash, hoping that maybe that can help with their addiction. What we're finding now is among those who OD'd, a significant number are living in permanent supportive housing. Our permanent supportive housing providers are saying we can't handle this anymore. We don't have staffing equipped to deal with this drug and the use of this drug. There are literally hundreds of people dying in permanent supportive housing who are on cap or who were on cap and we placed in that housing. So my conclusion is that the way that we have the services right now for supportive housing isn't sufficient to deal with this problem. People are still dying. So by taking the cash out of people who are living in this housing, we're hoping that at a minimum, they're not going to be using our cash to kill themselves. Still might. But we're hoping that it helps get them into treatment. It's a trigger to get them into treatment. We don't really know how to solve this problem. cities all over the country don't know how to solve this problem. It's in any urban core, you're seeing exactly what we're seeing. Philadelphia is ravaged. Ohio, years ago, I went through this, Seattle, Portland, Los Angeles. You know, this is a drug that we really don't know as a community of human services providers in public health. We don't know how to. And unlike prior sort of waves of substance abuse, the crack epidemic, crack and meth didn't kill people. You know, over time, maybe, right? It wasn't the instantaneous, you're dying of opioid overdose immediately. And so, you know, this isn't necessarily research-based or evidence-based. It's certainly based on data and what we're seeing people do. And given sort of, all the mayor would characterize this as a sort of dire situation of 3 people dying a day. She's trying anything. So that's what we're doing. Other questions? No, we can't do that yet. I'm not done. No, I just wanted to pause for questions. I don't want to stifle public comment, but I got a couple more things to say. I'll bring it up a little bit. Actually, I will, because I'm going to talk about budget cuts. So, as you know, the city continues to face a challenging economic climate. Delays in FEMA reimbursements for COVID costs, which are significant, hundreds of millions of dollars. Higher healthcare costs for employees, slow growth in business tax revenue. And so the mayor on October 11th asked departments to propose mid-year budget reductions to get out in front of the deficit that's anticipated to be about 500 million next year. And so all city departments were asked to propose reductions to our general fund budget by about 3%, which for us, when you peel away all of the mandatory general fund spending and get to our discretionary, it's about $1.6 million of a mid-year reduction. Now, remember, our budget overall is about $1.1 billion, so $1.6 billion is not a lot. But you know, and we've done these exercises plenty of times, and we always make every effort to minimize impacts on our clients, our community-based providers, and of course, our workforce. But given sort of that the caseloads that are growing, service demands that are growing, you know, achieving these sort of cost savings and reductions is growing more difficult. This 1.6, we've put together a package which we think will be fine in terms of no negative impact on our clients and staff and the like. Looking at state increases in state revenue in some areas and some other contracts that haven't started yet. So we'll be submitting that this week to the mayor's budget office. We're anticipating potentially more mid-year reductions, and we're certainly anticipating we get our budget instructions for fiscal year 24-25, seeing a reduction target as well. So as always, keep you up to date on directions we get from the mayor's office. Shifting gears internally, so our office, our Office of Diversity, Equity, Inclusion, and Belonging, I've talked about the office here a lot and all the work that we're really excellent work that office is doing, working with staff. And one of the nice things about this office is it gives us sort of an organizational lever to give a forum for our staff to talk with one another, talk to each other, talk to management about issues that are going on. And clearly what's going on in Israel and Palestine is a big deal for many staff, whether you're Palestinian or Israeli or just concerned. And so the DEIB team hosted a table talk at lunchtime 10 days ago. It was attended by 65 staff. The conversation was very instructive and informative. A lot of staff attended because they felt uninformed and they wanted to learn more about what was going on. Very respectful sharing of feelings and perspectives, listening to one another, sort of really fostering a sense of safe place to dialogue around this. As you might imagine, a lot of differences of opinion, but the discussion was very civil. Viewpoints were expressed without hostility, and really just a really good opportunity for staff to understand the conflict more and the complexities around it, and also having a way to talk about the feelings around it. So I think it's important to be able, as a big organization like this, with 2,400 staff, to create safe spaces for folks to be able to talk about this. You know, we spend, you know, 8 hours a day of our life, either in this building or online and doing this work, and it's a, you know, life happens and you're still going to work, and having this space is helpful. So I just want to thank the DEIB team for convening that, having that sort of foresight to think about that and convene it. Also DEIB, we administered our racial equity survey, which is an opportunity for employees to share perspectives on racial equity work at HSA. The input from the survey is used to sort of frame our plan for the coming year and future years in terms of, you know, where our staff want to see more of, more training, more opportunities for voice, things like that. So we'll have an update on that survey and then a future meeting once we compile all the data. Real quickly on facilities, the city's real estate division has introduced to the Board of Supervisors a lease for us at 42 Golf, which is just right around the corner. It's going to be a foster parent resource hub. It's about 1,800 square feet. It'll be managed by our Family and Children's Services Division in partnership with the Foster Parent Association. It'll be distribution center for donated items for foster parents, a training space, a meeting place for foster parents, and also for foster youth. So it was actually an idea from a couple of foster parents years ago. They wanted a place where they could convene and really have what they call a closed closet, but we're doing much more than that. So that's at the board. It'll go to the finance committee, and I don't anticipate any problem getting that lease approved. It's a pretty good rate. In economic sports self-sufficiency, the big thing going on right now is CalSAWS. We've talked about it a few times here. CalSAWS is the name of the new information technology system that supports all of our benefit programs, CalWorks, CAP, CalFresh, Medi-Cal, and others. We're going to cut over to the new system on next week, October 30th, along with Sacramento and San Luis Obispo, which are the last counties coming on board. So now all 58 counties will be on the same system. It also transitions our online application portal to what's called Benefits Cal. It's as of, well, today and tomorrow, it's called My Benefits Cal. Shifts over to Benefits Cal. That's the public facing portal. This is a huge undertaking, as you might imagine. It's over 1,000 new users internally. It supports about 200,000 clients. We've been preparing for this for over 3 years, extensive training, organizational change management, a lot of data and task cleanup for conversion, a lot of communications internally and externally with partners. And basically we go dark. We go dark on Friday, meaning our system will be completely down and nothing will be able to be transacted. Clients can still access their benefits through online portals, but Friday, we won't have access to any system. They do the data conversion and cut over the weekend, and then on Monday we flip the switch on and hope it works. I'm joking. It'll work. I promise it'll work. But it's this is the second one of these I've gone through. I went from the shift to CDS to CalWin, and there were fits and starts, but and there will be problems, minor, I hope. But we're providing breakfast to staff. We're going to be on site all week. We have command centers in each building. People roaming the floors, providing assistance to our staff, and having a way to escalate problems immediately to the command centers to resolve issues. So one of the beauties, we're going last. We're in wave 6, so the 55 counties are already live. So a lot of the bumps in the road that happened 18 months ago, have been fixed. And so I'm joking aside, I'm really confident that this is it'll be fine. It's a learning curve, but I think once we're used to it, I think it's a better system than the current system. So just take a moment to thank the CalWin team and the SSS management and staff. So I said CalWin team, the CalSAWS team, it's a heck of a lot of work. So just thanks to you all for sticking with it and looking forward to cutting the ribbon on Monday morning. Yeah, yes, you would. When do we flip the switch? I think it flips before we're all awake, but hopefully when we come in the morning, it's going to be operational. Anyway, I'll let you know in a month how it. Okay, this report's for now. Bear with me, I'm almost done. Workforce Development Division, this is a neat thing that they did. So we held a resource and employment fair for individuals with limited English proficiency. So the pilot event was geared to individuals who speak primarily Spanish and or Chinese, as a really an effort to connect limited English speaking folks with resources and employment opportunities. We had 137 residents sign up. We had 12 providers and employers. We had the Latino Task Force on hand to assist with right to work documents, providing information to employers to give, to create the employment opportunities for folks. Seas Candy actually hired 10 individuals on the spot for production positions, paying $27 an hour. That's $54,000 a year, doesn't look that. They also took applications for follow-up after the event. A company called Gate Gourmet hired 6 individuals on the spot as well. The feedback from attendees and from community-based partners and staff was really positive, and it really highlighted a need, I think, in the community to keep doing this. So we're definitely planning a future events and continue to focus on, among other populations, certainly our immigrant communities and folks with limited English speaking ability. So kudos to WDD staff. It's a really neat event. There were some great pictures. It was very well attended. People were seemed very excited to be there. And lastly, Family and Children's Services, we launched our new guaranteed income program for former foster youth on October 16th. We issued a press release about the launch of what we're calling Foundations for the Future. And this is, again, a guaranteed income program for former foster youth, supported through funding from the State Department of Social Services, City County of San Francisco, Juvenile Probation, as well as us, of course. And then the nonprofit agency Tipping Point is providing significant funding as well to do evaluation and other support. So the program, again, it's called Foundations for the Future, will provide 150 low-income youth who recently aged out of either foster care or the juvenile probation system with monthly payments of $1,200 for 18 months. And if you know how guaranteed income works, it's there's no strings, there's no requirements on how the individual would spend this money. It's basically you get $1,200 a month for 18 months, and we evaluate to see what improvements in folks' lives occur, how they use the money, whether it's for school, housing, car, whatever. But we have an evaluative component with it to sort of determine the impact of this program. Again, it's an 18-month program. We're one of just 7 agencies across the state to get this. It was a competitively awarded grant. The story was covered on KQED radio on the 16th. It was a good story about it. The mayor's super excited about it. As soon as we have folks enrolled, she wants to do an event with them and at least meet some of the youth. We sent out the application link to over 100 former foster youth and former probation youth. And so far, we've received 54 applications. So it's great. Over half have already responded. And again, our goal is 150. We're funded for 150. And then lastly, thanks for sticking with me. November's National Adoption Month. And Angela Ramos from our staff will present a proclamation today. You all commissioners have been invited to the National Adoption Day of Observance. It's at the courthouse at 400 McAllister. It's going to take place around lunchtime, 12:15 on Friday, the 17th of November, with snacks for the families, professionals, HSA, and core staff. And then several children will actually be adopted that afternoon, and the adoption hearings begin at 1:30. Commissioner Khan, I think, has attended in the past. It's really a neat event. So hopefully we will be able to attend with our staff. So after that very lengthy report, I wasn't here last month, so I had to make up for lost time. I'll conclude, commissioners. Happy to answer any questions.
Any questions from members?
Just close down on that thing. I think it starts at 12:15. Yeah. You would hope to see you there. Shoot, I'm not gonna be there. I'm sorry. I won't see you there. Good, great.
What comment please? Sorry.
Is our employee of the month. On behalf of the Human Service Commission and the Department of Benefits and Family Support Executive Team, we are pleased to announce that Rosanna Garcia, Senior Clerk with Family and Children's Services, is the October 2023 Employee of the Month. Rosanna is an asset to the FCS program as she does a tremendous job with her clerical duties. She is very efficient, reliable, and hardworking, and she does it with a great attitude and a smile. After 20 years with the agency, Rosanna continues to work hard and go above and beyond to get the job done. This includes assisting all eligibility staff in retrieving and submitting important documents. Rosanna demonstrates high-quality work performance, ensuring her tasks are done properly and in a timely manner. She communicates with the eligibility workers on her team. If there are any issues or anything to look out for as a courtesy, she keeps the team in the loop, which is greatly appreciated. EWs are constantly busy with caseloads. A team player, Rosanna always can be counted on to provide extra support when needed. Despite having a full workload of her own, she always checks in with her colleagues and finds ways to work easier for them by doing things like finding, ordering supplies, submitting workflows. Simply put, Rosanna makes the job of an EW easier and their work flows smoothly. Rosanna is so knowledgeable on her position and program needs. She helps even when she doesn't have to. She helps because she can at the moment or knows what is needed, so she gets the job done with no hesitation. She is an essential part of the FCS family. Are you listening to this?
Yeah.
Don't fall asleep. Rosanna makes the workplace a positive environment. She goes out of her way to remember to make her colleagues feel special on their birthdays, joins in and contributes to all staff functions, and is the life of any team gathering. Her quirky personality makes her colleagues laugh, and everyone appreciates and respects her upfront honesty. Rosanna is a leader in her position, a teacher of life, and a friend to most. Thank you for your hard work and contributions, Rosanna, and congratulations.
So please, you are always smiling. Whenever I get to see you in the elevator, it's bright as night. Right? The importance of the work is clear for those of you who don't know. The eligibility worker status, yes, so one of the ones to allow our foster parents, our resource families to get paid. They've proved us, so it's obviously such a vital piece of what family families do. And to be able to honor you for supporting that team, and their work is great, but most of all, you do just bring such a bright light to this agency and this building. See the elevator, keep smiling. Congrats.
Moving on to item 7 on the consent calendar. Any of the commissioners want to remove an item for individual discussion? Nope. Hearing none, is there any public comment?
Closing public comment.
I move.
Consent calendar.
All in favor? Aye. Darshan, can you raise your hand? The consent calendar has been approved. Item 8A is a request to proclaim November as Adoption Month. Angela Ramos.
Good morning, Commissioners and Executive Director Trent Rohr. Is this on?
No. There you go.
Okay, so let me repeat myself. Good morning, Commissioners and Executive Director Trent Rohr. My name is Angela Ramos Reyes. I'm the Program Director in Family and Children's Services.
You don't have to be as sorry, hon. You don't have to be quite as close,
Oh.
and it'll get you.
Yep, got it. Not too close. I have the oversight of the adoptions program in Family and Children's Services. I am here this morning on behalf of Family and Children's Services to respectfully request for you to proclaim the month of November as National Adoption Month. National Adoption Day is a collective nationwide effort focused on raising awareness of children in foster care waiting to be adopted. The first major effort to promote awareness of the need for adoptive families was in 1976 when the state of Massachusetts initiated Adoption Week, an idea that grew in popularity and spread throughout the country. Now the United States dedicates the entire month of November as Adoption Month. During this time, states, communities, public and private organizations, businesses, and families come together to celebrate adoption as a positive way to build families. Activities across the nation, such as recognition, dinners, public awareness, and recruitment campaigns and special events shed light on children who are in need of permanent families. I am proud to announce that San Francisco County celebrates the success of 66 finalized adoptions within the fiscal year of 2022. For 2023, as of now, 34 adoptions have been finalized and counting. I enjoy attending the celebration that is held in the San Francisco court in November to celebrate national adoptions. We look forward to seeing you there. I want to give special acknowledgement to our adoption staff. With me today is Alan Botts, the adoption supervisor, Mariela Padilla, Brandon Gensler, Amy Hibbs, Sally Regalado, Amber Lee, Tanya Powell, Maria Jose Cabrera, and Janice Anise. Our staff collaborate with attorneys, the court offices, judges, CASA workers, representatives from the Family Builders Foster Family Agency, and service providers to provide resources and support to children and caregivers. Thank you so much for your support and your part in making all of this happen. I am going to have Alan read the proclamation.
Good morning, Commissioners. Trent, with your permission. Proclamation urging November 2023 be declared Adoption Month. Whereas children are key to the state's future success, prosperity, and quality of life. And whereas all children and youth deserve a safe, loving family, yet in San Francisco as of October 20th, there are 668 children, youth, and young adults, non-minor dependents, in foster care. And whereas adoption creates supportive, loving families for children, youth, and young adults. And whereas in San Francisco, we have finalized 66 adoptions in 2022 and 34 adoptions as of now in 2023. And whereas the stability and permanency for foster children, youth, and young adults is of the utmost importance. And whereas permanency is defined as both a process and a result that includes the active involvement of the child or youth. And whereas there are no restrictions on who can adopt based on race, ethnicity, religion, sexual orientation or expression, gender identity, or marital status. And whereas during National Adoption Month, we celebrate all those who have invited a child, youth, and young adult in need into their hearts and into their homes, and express our profound appreciation for all who help make adoptions possible. Whereas there are dedicated community-based organizations within San Francisco that partner with the Human Services Agency to find families for children, youth, and young adults in foster care who are waiting to be adopted. Now, therefore, be it resolved that the San Francisco Human Services Commission proclaim November 2023 as National Adoption Month and urges all community members to support and engage in activities that strengthen families and communities to provide the optimal environment for children to learn, grow, and thrive, so that all children and youth have the benefit of happy, healthy, and safe homes. Very much. Thank you.
Thank you.
Are there any comments from members of the commission? Is there any public comment?
Raise your hand if that's sorry for we remember. Inclusive of.
Is there a motion to A?
I move the proclamation of November as Adoption Month, item A.
Is there a second? I'll second it. All in favor?
Aye.
Aye. Darshan? Great. So moved. Thank you very much. Item 8B is a new grant agreement request from Cal OAR System Improvement Plan presented by Jaya Varma.
Place for you. Maybe general, yeah.
Good morning, President Khan and Commissioners. My name is Jaya Varma, and I'm a CalOR Senior Administrative Analyst at HSA. I'm joined today by Moon Tai, who is the CalWorks Director and who's also available to answer any questions. We are requesting approval of the county's CalOR System Improvement Plan for the CalWorks program from November 1st, 2023 through January 30th, 2026. CalOR stands for CalWorks Outcome and Accountability Review. It's a continuous quality improvement effort statewide conducted on a 5-year cycle where counties first assess their own CalWorks program, then identify strategies for improvement, which is the step we're on, and finally assess progress on their improvement efforts. In May 2023, we completed the first step of the cycle and submitted our self-assessment. To complete the self-assessment, we analyzed data on about a dozen performance measures that CDSS provided to us as part of the CalOR effort. We also analyzed demographic and caseload data ourselves, reviewed our organizational structure, partnership services, and gathered feedback from staff, external partners, and clients through focus groups and interviews. Once we submitted our self-assessment, we moved to determine which were the most important issues to focus improvement efforts on in our System Improvement Plan, or SIP. We ultimately decided to focus our plan on improving two performance measures. First, on client engagement in CalWORK's Welfare to Work, which is the percentage of CalWORK's clients participating in Welfare to Work services or activities. We've been about at 17 to 19% on this measure lately, and we'd like to get this up. Our plan lays out 5 strategies to do this. First, improving connections to training and educational opportunities. 2, examining data on clients who haven't been engaged for 3 months or more and conducting focused outreach to this population. 3, promoting case management practices centered around behavioral science, such as individualized coaching and goal setting. 4, improving communication materials to make them more understandable, informative, and motivational. And 5, utilizing our regular performance management system for Welfare to Work staff to focus on the goal of improving client engagement. The second performance measure we're targeting for improving is reducing re-entry to CalWORKs once families have exited. Compared to the state, we have a bit more CalWORKs families returning to CalWORKs once they've left. 21% in San Francisco compared to 19% statewide. In our work and focus groups as part of the self-assessment, we also heard about a fear of a benefits cliff, discouraging clients from seeking employment and career advancement opportunities. So strategies that we'll be trying out to reduce CalWORKs reentry include: 1, creating an incentive program for clients who discontinue from CalWORKs with employment. 2, expanding case management to those in post-aid services, beyond ensuring that clients have access to transportation and childcare benefits post-CalWORKs. And 3, improving the quality of our informational materials and resources outside of CalWORKs and helping clients connect with them. For example, the Earned Income Tax Credit. As part of our work on this goal, we'll also examine data on the incentives and the client's reentry to CalWORKs. So that is a general summary of our CalWORKs System Improvement Plan that we're submitting for approval today. This is a non-financial request. At this time, we believe we can carry out our improvement efforts by utilizing our existing partners and contracts and shifting existing funds. We are happy to answer any questions that you have.
Thank you, Jacob. Are there any questions from members of the commission?
Commissioners, we have to take a break, so we need to wait for him to reach out.
Or he doesn't hear. So I'll take public comment at this time for item 8B. Raise your hand or star 3 if you're calling in. Closing public comment at this time. We're going to hold voting on this item until commissioners see the term so we can move on to 8. Thanks for your patience.
We're going to move on to item 8C for Ariba Juntas.
President County Commissioners, and Andy Beatley Hager, our program monitor for the Housing Assistance and Intensive Case Management for Ukrainians. Department of Benefits and Family Support requests authorization to enter into 2 grants for housing assistance and intensive case management for Ukrainians for the period of November 1st, 2023 through September 30th, 2024, and the total amount not to exceed $2,161,144. The purpose of these grants is to provide housing and utility assistance administration, as well as intensive case management services to eligible individuals displaced from Ukraine. In February 2022, an estimated 4.6 million Ukrainians fled our country after Russia invaded. On April 21st, 2022, the Department of Homeland Security announced the Uniting from Ukraine program, which provides a pathway for Ukrainian citizens, immediate family members to enter the United States as humanitarian parolees. The California Department of Social Services Refugee Programs Bureau developed the Housing Assistance for Ukrainians, or HAU, program to support the transition of recent Ukrainian arrivals to long-term housing in California. Mission Neighborhood Centers, or MNC, will recruit and screen potential participants and then conduct assessments to identify eligible HAU expenses for those participants. MNC will then issue payments for approved HAU expenses, including back rent, debt to utility companies, current rent subsidies, and other costs per HAU guidelines and approved by HSC. Arriba Juntos, or AJ, will provide direct intensive case management services to support applicants' progress towards employment and self-sufficiency. AJ will also provide social adjustment linkages and workshops that allow participants to understand and effectively utilize available services. Program goals are to enroll 130 families and to ensure that 95% of those families remain stably housed 3 months after enrollment. I'm available to answer questions regarding the services. Representing for Arriba Juntos, we have Gladys Garcia, Director of Programs, and Patricia Melgar, Training Coordinator. And for MNC, we have Aurora Alvarado, Director of Homelessness Prevention Services and Aging and Disability Services, and Isabel St. Germain, Chief Program Officer. Thank you.
Commissioner Singh, so can I have I'm asking for a motion to approve going back. Okay. Is it, are there any comments from members of the commission?
Just a question of 130 family goal, what do we anticipate as a possible catchment load for this? I mean, how many folks are coming and how many are we looking to try to handle?
That's the question. It's not always easy to get a perfect figure. Even the state, when they're reporting these figures, doesn't have an exact number of Ukrainians. I think what we're looking at is, you know, in terms of HSA caseload, I think the best way to phrase it is that before the conflict began, and going back maybe a year or two ago, the number of folks on RCA caseload, which is refugee cash assistance, was typically around 20 to 25, and now we're over 200. So that really is in large part based on the influx of folks coming from Ukraine, although of course there's others coming from all over the world, Central America, South America, etc.
Does grant have any room for if we don't have $2 million worth of program to give to Ukrainians directly, can we pull it over to our other assistance program?
It's a very good question, but maybe in a better way of answering that and answering your first question is to say that I've noticed a lot of interest already for this program, even before it began. It's kind of in an unprecedented way. We've had a sort of a deluge of applications already applying through our partner, Arriba Juntos, has been working with this population, you know, over the last year and a half. And we actually already made direct payments to 4 clients just through HSA already, because we were, you know, given the authority to use those funds. So I don't have any doubt personally that we'll be able to help, you know, that we'll be able to utilize the funds to help as many families as we can. Yeah.
Grant?
I think we'll have the ability to shift it to a different revenue population. I trust Andy.
And housing services will be used, you know, there's just such a need for housing for not only for Ukrainians, but for all services. But, you know, we're getting applications and interest from people even out of the county, just to give you an idea. Someone from Santa Cruz the other day, yesterday I had someone who's in Los Angeles area asking for assistance. So it's a statewide program, and I think in San Francisco, we'll have no trouble helping people with that much.
Thank you very much.
Raise your hands if you have public comments. Other contracts. Either Ayuntamientos or Mission Neighborhood Centers. Doesn't look like we have the use, so we'll close public comment at this time. President Tom, you have to do 2 votes, one for Ayuntamientos and then one for Mission.
I have a motion to approve item 8C for Arriba Juntos.
I so move Arriba Juntos Intensive Care Management, not to exceed 549,644. Is that how we're dividing it up? That is my
Yes.
motion.
Is there a second? All in favor? Aye. So moved.
I move item 8C for Mission Neighborhood Center for $1,611,500.
Is there a motion to approve?
Second.
All in favor?
Aye.
So moved.
Now we can go back to 8B, now there's Commissioner C back with us.
8B, I'm sorry. Excuse me.
I move item 8B of the Cal or grant.
Is there a motion to approve?
Proposal,
So,
improvement plan.
all in favor?
Aye.
So moved. Item 8D is a request to enter into a new grant agreement with ICF Resources presented by Karina Jang.
Morning, my name is Karina Zhang, and I am a program support analyst with the Family and Children's Services. I'm here to request authorization to modify the contract with ICF for the period of January 1st, 2024 to December 31st, 2025 for the additional amount of $944,522 plus a contingency for a revised total amount not to exceed $2,026,131. The purpose, sorry. Too close. The purpose of the contract modification is to provide 2 more years of funding to continue to provide technical assistance, guidance, and best practices in the development and implementation of a citywide child abuse prevention plan. With ICF's assistance, San Francisco successfully completed and submitted the comprehensive prevention plan to the state in April 2023. The plan was approved without a single question raised by CDSS in the following month. Immediately after the plan approval, FCS started a pilot the prevention pathway with community-based organizations who have been a part of the plan development process since the beginning of 2022. FCS is now working with a large network of community and agency partners to further expand the implementation of the prevention pathway, as well as evidence-based practices that are identified in the plan as being critical in changing the trajectory of the families that are at imminent risk of entering child welfare and addressing disproportionality and disparity in San Francisco. FNPSA brings upon opportunities for San Francisco to create and sustain prevention programs using Title 40 dollars that used to be a resource only for families in the child welfare system. But FNPSA is a highly complex initiative. San Francisco will need the technical expertise and resources provided by ICF to make sure that the system we build maximizes the use of all available funding and meets the regulatory requirements for Title 40 funding. Moreover, it is essential to have a neutral partner like ICF to be facilitating discussions with all the agency and community partners to ensure that all resources related to this initiative are distributed in a fair and equitable manner. The FNPSA Planning Committee in San Francisco collectively agree that FNPSA should be a community-driven effort and that there should be a very light touch with the child welfare system. Utilizing a third-party implementation expert to support the building of a community prevention pathway is the only way to ensure that all voices are heard and that all perspectives are considered adequately in the process. And I also have here with me the ICF Project Director, James Kaloma. He's online with us today, and we will be happy to answer any questions you have about this question.
Are there any comments from members of the commission? Hearing none, is there any public comment?
Please raise your hand or start reading for related to item 8D. Oh, I'm sorry. I'll close the public comment. Varshan is not on camera right now. Commissioner Singh, can you please go on camera so you can vote? This is our last item for closed session. Commissioner Singh, we need you on camera.
Oh, it keeps lining up and then, so.
Commissioner Singh, can, if you're having trouble with your camera, can you just let us know that? Say hi.
Don't touch anything. Get your hand off.
Okay, perfect. There you are. Wonderful. Okay, you can move forward with the vote.
Is there a motion to approve?
I so move.
Second? All
Second.
in favor? Aye.
Aye.
So moved. Item 9, general comment from the public.
Public comments. Any items related to the department benefits of being supported. So, 3, we're going to hand. Does not look like we have any public comments. Votes.
Motion 8. So am I supposed to ask for, you've already asked for from the public comment, so can I have a motion? Pardon me? Okay. Okay, so we're going to move into closed session.
Okay.
Do we need to adjourn? Or just go into closed
I
session?
don't think so.
Right. Yes. Okay, we can be, yeah. You have to adjourn.
Okay. To close session.
I
Is there a
move,
motion to adjourn?
I move we adjourn.
All in favor?
Aye.
So moved.
Okay. I think you want to go close.
Your compliment.
Don't do any, what are you doing?
I don't know what I'm doing.
Yeah, let me just go to the door.
Are you opening the door for, wait, this is Passover. She's opening the door for Elijah. Come on in, Elijah.
Come on, you gotta
I'm
come
not-
in. Watch out now, this is the day, man. Don't be asking for the day. I'm not ready for the day. Hold on.
Okay.
At this time, I think I'm not gonna comment. Sorry for your.
Meeting is adjourned.
Amen. Thank you.
Amen.